Can you imagine being in the midst of a community where people are rapidly becoming infected with a deathly virus? A small town in Indiana can, as they are currently facing this issue. In fact, in Austin, Indiana, and surrounding areas, they are currently facing an HIV/AIDS epidemic. With 22 new cases per week, it's no wonder the state has declared state of emergency at a record breaking time like this. Today I'm going to inform you all a little bit about how this epidemic began, what officials are doing to stop this epidemic, and why it's so important to keep our community properly informed of the crisis at hand. It all began when a prescription painkiller hit the market a couple years ago. This painkiller is popularly known as Opana. Opana became very appealing to drug users as it's very accessible and very cheap. As more and more users began using Opana, the reported overdose became an all-time high. Government officials wanted to get this drug off the streets, and by doing so, they made prescriptions much harder to get, and they recreated the drug to make it less appealing to drug users. What government officials didn't know is they were soon going to have another problem on their hand. A new drug was going to take the place of an old prescription, a drug that's been around for thousands of years: heroin. Heroin was directly connected to the HIV/AIDS epidemic. To get the full effect of heroin, most addicts who use heroin resort to needles. Ta-da! That's where the epidemic all began. When addicts began using together, they sometimes face a limited amount of needles, which calls for another problem: the sharing of needles. Of course, every opiate user wants the best high they can get, therefore they are willing to do whatever it takes. So far, there has been 79 confirmed cases in southeast Indiana. Officials have tried to stop the epidemic by providing clean needles to anyone who wants them. They have done this by setting up a clean needle exchange where they will give you clean needles in exchange for dirty needles at no price at all. Officials have made every attempt to remove dirty needles from the streets of Indiana, as careless drug users simply throw them on the ground. Officials continue to fight the heroin epidemic and get the drug off the street, and hope to also stop the HIV epidemic that seems to be connected. It's so important for the government and media to inform the community of this ongoing issue so that the people of the community take extra precaution. With such a serious disease roaming the streets, it's important that people are reminded to never share needles, to always have protected sex, and to get tested for diseases such as HIV/AIDS. 22 cases a week in just such a small town is a really big issue. Therefore, this community and other communities must take all possible precautions from allowing the disease to continue to spread. If people weren't aware of the extremities of the current epidemic, then programs such as needle exchange and rehab wouldn't be so effective. Also, people in the community that may be effective wouldn't know to get tested, and they would be more prone to spreading the disease. Individuals would be more likely to have unprotected sex or share needles if they weren't aware of their condition. As you can see, HIV is a serious current issue in our local communities today. It should be taken seriously and handled with the appropriate actions, like informing the people, specifically of Scott County, of the ongoing problem at hand. Although it is an unfortunate time for the people of Indiana and other infected areas, it is important to stay aware of why and how this epidemic began, how government officials are controlling the epidemic, and why the community must be informed of the surrounding issue. It's crazy how such a small town in the rural part of Indiana can face such a serious health crisis. It's important for the state to remain under state of emergency and use every available resource to correct this problem before it has a chance to get worse. Nobody wants to be surrounded or put at risk for this fatal disease, so imagine how helpless towns like Scott County must feel. HIV can and will kill, so it is important for us to put a stop to this disease no matter what it takes. Thank you all very much.